about sleep and integrative approaches to help someone sleep better. So, insomnia is super common, very prevalent in adults and teenagers. And, when we think about helping people sleep, I like to think of medications as kind of the last resort to help with sleep and really focusing on like looking for underlying causes of why someone is having trouble sleeping and then consider non-pharmaceutical approaches. Unfortunately, a lot of the sleeping medications that we have to help with sleep seem to disrupt people's sleep cycles. So like the REM cycle, for example, and a lot of them can be habit forming and have side effects that aren't so great. So that's why we kind of focus on looking at underlying causes, considering non-medication options first, as well as lifestyle changes. So when we talk about sleep, I like to get a really good idea of what is going on with your sleep. Is there an issue with falling asleep? And sometimes troubles with falling asleep can be related to anxiety more often than not. Does someone have catastrophic thoughts around not sleeping? Is there any caffeine use, particularly in the afternoon or evening? What does someone's screen time look like, particularly in the couple hours before bed? Is someone napping a lot during the day? What are their habits around sleep? So, getting a clear understanding of what's going on there. If someone is having trouble staying asleep, sometimes that can be related to uh, clinical depression. Um, Sometimes that can be related to environmental factors. So, are there pets or kids or loud noises? Or is the room too warm? Is someone having nightmares? Does someone have obstructive sleep apnea? So those things can all contribute to someone not being able to stay asleep through the night. And the other thing I ask about in terms of a history is someone having nightmares? Sometimes that can be related to PTSD. So underlying causes of sleep issues. So in my intake and when I meet with someone, I'm considering, do they have restless legs? And I'll talk a little bit more about that. Do they have obstructive sleep apnea? What is their caffeine use like? Do they have underlying anxiety, depression, trauma, ADHD? And is that contributing to their sleep issues? What is their screen use like? What are the environmental factors? And so, takeaway number one, if at all possible, we address the underlying causes of sleep issues. And takeaway number two is lifestyle and behavioral interventions over pills. So when we think about restless legs, so basically restless legs, it's actually a specific diagnosis that seems to have a circadian pattern. And so basically this is something that happens overnight where people have this urge to move their legs. And that discomfort is relieved by movement. And different studies have actually shown that people with ADHD do have an increased like motor restlessness during sleep. And there does seem to be this connection between ADHD and restless legs. So people can sometimes feel like it's a creepy, crawly feeling, an urge to move their legs, much more common in people with ADHD than people without ADHD. And there does seem to be this underlying risk factor of iron deficiency and or magnesium deficiency. So with iron deficiency, it's something we can actually measure, what your iron stores look like, and also checking a certain lab called ferritin, which is a protein, which is a more accurate measure of iron deficiency in your body. And so ideally, someone is going to have, if they have ADHD, I will often recommend checking a ferritin level if they're having trouble sleeping at night. And we would want to optimize the ferritin by greater than 50 for a level. Magnesium deficiency is a little bit trickier. So, magnesium in general is really hard to measure, to accurately measure. So, we can measure like a serum magnesium, but that can be misleading. So, sometimes you might have a conventional doctor order a serum magnesium level. And what's tricky is that only 60% of our magnesium is in our in our tissues and less than 1% is in our serum. And so even if a serum level is normal, there could actually be a depletion of the stores in our tissues, so like our bones and muscles. Um, we can check another magnesium lab called the red blood cell magnesium, or RBC magnesium levels. This is considered to be a more reliable way to check magnesium status. But this test is often more expensive and it's also not completely accurate. So typically in my practice, I don't check magnesium levels. And the treatment of magnesium supplementation, often the benefits outweigh the risks for a trial with magnesium. So checking for restless legs, especially if someone has ADHD, is really important. And then optimizing magnesium and iron related to that. Obstructive sleep apnea. So this is actually a pretty common condition. It tends to get missed in people who are normal weight and in women in particular. And so symptoms of obstructive sleep apnea might be things like headaches during the day, significant daytime fatigue, and sleepiness. So if someone is telling me that they're having trouble staying asleep when they're driving, and they have headaches and just like feeling kind of crummy during the day, it's really important that we do a screening for obstructive sleep apnea. There is a specific screener called the Stop Bang, which gives us a pretty good indication of if someone is at high risk for obstructive sleep apnea. And if someone does have a higher risk, I will recommend that they do some sort of sleep study, whether that be an at-home sleep study checking oxygen levels, or going to an actual sleep center or hospital and staying overnight to get the sleep study done. And if obstructive sleep apnea is suspected, typically the treatment is going to be something called the CPAP, which is a mask that increases oxygen flow throughout the night. The other thing to consider is caffeine. So the half-life of caffeine in adults is 5 hours. So that means that caffeine stays in our bloodstream for 10 hours. So when we think about when you last had caffeine during the day, know that it will stay in your bloodstream 10 hours after that. So limit caffeine ideally after like 1 p.m. Some people are really sensitive and just trying to avoid caffeine in general might be a good idea. And so something to keep in mind is seeing if you can gradually reduce caffeine intake if needed. The environment, so you want to make sure you have a consistent sleep schedule. Us as humans tend to do best with that if at all possible. Complete darkness in the room. Limit screen times at least an hour before bed. Cooler temperatures, so keeping your room 60 to 67 degrees Fahrenheit. Making sure you're moving, particularly if you're moving outside during the day. Things like a hot bath or sauna use before bedtime also can be helpful, because what it does is it actually increases your body temperature. And then when our body temperature decreases when we're done with either of those activities, it makes us naturally feel more tired. And then having some sort of wind down routine can be helpful. One of the best studied and kind of gold standard treatment for particularly chronic insomnia is a therapy program called CBTI for insomnia. So this is basically a structured therapy that involves relearning how to sleep. There is a component of sleep hygiene, recognizing automatic thoughts, catastrophic thoughts around sleep, and practicing reframing those thoughts. And then there is a component of sleep restriction. So that will help people get better quality sleep. And with each week, the amount of sleep time is typically increased by a small increment. So there are randomized control studies showing that this is very helpful and shown to be as effective as sleeping medications, if not more. It's something that you can do online through a digital program like Sleepio, for example, which is Sleepio. I work with people here in our clinic, and we can do a week by week, 6-week CBTI program, or there are other therapists who are trained in this model, in this modality. Let's talk about blue light blocking glasses to help with limiting LED screen time. So, when it comes to the use of blue light blocking glasses, the research is actually mixed as to whether it can help with sleep. So blue light, which is emitted from electronic screens as well as kind of like higher, like bluer, cooler lights from ceilings and lamps. So blue light has been linked to disruptions in our circadian rhythm and basically decreases melatonin production as we get closer to bedtime. And studies show that children actually are even more sensitive to this than adults and teenagers. So, the theory behind these blue light blocking glasses is that it blocks out specific wavelengths in the hours before bedtime, and that can help improve sleep quality by minimizing the circadian disruption. So, some studies show that it can be helpful for helping people fall asleep quicker and getting better sleep throughout the night, but some studies shown that there haven't been improvements. Another thing to know with these blue light blocking glasses is that there is no like just like supplements and vitamins, there's no FDA standardized glasses that exist out there. And so when you buy them, you don't know if you're getting exactly what the description is. I do typically recommend people consider the glasses that are used and purchase the glasses that are used in the research studies. Let's see. The other things that you can do to limit blue light or LED exposure is to really try to limit the amount of screen time you have in the 2 to 3 hours before bedtime. There are screen filters available that seem to help block blue light. One of them is called Night Shift. It's available for Apple devices or a free download called f.lux. So F period lux, Lux. And then consider using lower color temperature lights, anywhere from 2000 to 3000 kelvins. So this is going to be more of a warm white color than a warm cool or a cool white color. Or even using candles actually can be really helpful. Melatonin is a supplement that, when we think of natural sleep aids, this is a really commonly recommended and utilized sleep supplement. So basically, melatonin, it is found in animals, in humans, and higher plants. It's actually it has a lot of different roles. It is actually an antioxidant that has evolved to help combat oxidative stress in the body. In humans and us, it is made by the pineal gland in your brain um, at night, and it's actually a precursor for the neurotransmitter serotonin and plays a key role in regulating our sleep wake cycles. So, as the sunlight fades in the evening, melatonin production ramps up. It signals to the body that it's time to prepare to sleep. And then over the course of the nighttime, these melatonin levels drop off in the morning with exposure to outdoor light. So, melatonin has shown to be effective for helping people fall asleep and particularly helpful for people who have jet lag, people who have irregular sleep wake cycles, people who have what we call a delayed sleep phase disorder, where their bodies naturally want to go to bed late and wake up late. So we can utilize melatonin has shown to be effective for helping people shift their sleep cycle to fit more with society, for example. It is considered generally safe for short term use. The long term effects are unknown. Sometimes people ask, is there a chance that my body could become dependent on it, or where I no longer make melatonin um, intrinsically? And the answer is we don't actually know yet. There are some studies that have shown that this is not true, so it's unclear at this point. But there hasn't been shown to be any overwhelming evidence that supports that. So melatonin is actually shown to be really helpful for people with autism spectrum disorder. People with autism tend to have just a difficult time falling asleep and staying asleep in general. Research shows that this might actually be related to a mutation in this ASMT gene that is responsible for melatonin production. And so, a prolonged release of melatonin can actually be really helpful for frequent wakening throughout the night. The doses used in studies is starting at 2 milligrams of prolonged melatonin once daily, 30 to 60 minutes before bedtime, and the dose can be increased up to 5 or 10 milligrams if needed over the course of a couple of weeks. Magnesium. So, magnesium is a pretty common supplement used to help with sleep. It supports making neurotransmitters like GABA, which is more of an inhibitory and relaxing neurotransmitter. It has calming effects. Magnesium has shown to actually inhibit uh, excitatory neurotransmitters like glutamate. And so that can help us feel more calm. It regulates stress response through the hypothalamic pituitary adrenal axis, the HPA axis. Like I mentioned before, it's really difficult to measure someone's magnesium stores in their bodies through labs. So it may help with sleep. It may help with people feeling more calm, particularly at bedtime. It can help with restless legs. People with ADHD, it can also help with sleep there. It can help with migraines as well. It is overall pretty well tolerated. I'll mention that there are some forms of magnesium that tend to be better tolerated than others. I will talk a little bit more about the different forms. So, the magnesium citrate form, this form is bioavailable, which means, or strongly bioavailable, which means that our bodies can easily absorb this form of magnesium. However, magnesium citrate can actually have a laxative effect. Magnesium glycinate is a form that is known for being more gentle on the stomach. It tends to be better tolerated, and this makes it a pretty good choice. It is also highly bioavailable. Magnesium oxide is another form. This form is expensive or less expensive, but it does tend to be less bioavailable than the other forms. And it can also cause loose stools and digestive upset. The magnesium citrate, the first one I mentioned, it can also have a laxative effect. The other form I'm going to mention is a newer form. It's called magnesium L-threonate. And this newer form is thought to actually have a higher brain bioavailability, so it can better cross the blood-brain barrier and thus potentially impact brain function, cognitive function. So it's important to keep in mind there are different forms. If you're shopping for magnesium, the glycinate form is more difficult to find in typical places like Walgreens. There are certain different forms of it. So there's a capsule, there's powders, there are gummies, and then there are Epsom salt baths. The gummies are going to be the most expensive and may actually contain the least amount of magnesium, so just keep that in mind. They might be a easier way to take it, but just be aware of that. If people are going to be looking for gummies, the well-absorbed forms like magnesium glycinate are typically recommended. The Epsom salt baths, those can be really great, but they may have like a lower bioavailability than the powders or the capsules. So capsules and powders are going to be containing the most amount of magnesium. And then another option that I'll mention too is a supplement called L-theanine. And so L-theanine, it's actually a specific amino acid naturally found in green tea leaves. It makes up just a small percentage of green tea's entire composition. So it's only like 1 to 2% of green tea. And it's thought to be responsible for some of the calming and focus enhancing effects associated with green tea. Unfortunately, there is no comparable amount of green tea that you'd have to drink a lot of green tea to get the amount of L-theanine that's been used in a lot of these studies for sleep and feeling calm and anxiety. So that is an option that can help people with sleep as well in terms of supplements. So, just a review of an integrative approach to sleep. We consider ruling out restless legs, obstructive sleep apnea, optimizing magnesium and iron. Um, Consider other psychiatric causes of sleep issues, like blocking glasses and limiting screen time and decreasing LED light exposure in particular, decreasing caffeine, particularly in the afternoons and beyond, considering more commonly natural, commonly used natural sleep aids such as melatonin, magnesium, and L-theanine. Typically, people may find benefit of having several different sleep tools available to them, and depending on the severity of their symptoms or what's going on, um, having just different tools available can be helpful. And the last but not least, the CBTI therapy program as a possible treatment option that is not habit forming, typically doesn't have side effects, and is accessible for people. So there you go. There is an overview of an integrative approach for sleep.